Hi everyone and welcome back to Primecast. This is our new YouTube channel and today we're going to be speaking about complications that can happen with gastric sleeve surgery and plastic surgery. So Rianne, there's a few questions sent in by patients. What are the main concerns regarding complications with gastric sleeve surgery and why?
The main ones I would say are leaks, blood clots and conditions like health conditions that they don't actually know before surgery, and the only thing that they could prevent that is doing the pre-op tests. So you would need to do loads of pre-op tests and check them very thoroughly, and that's why we have a whole long list of pre-op tests, and we do actually have found a few issues with patients and we just didn't let them to have the surgery, didn't go through, or they had treatment here and then they had the
pre-op
surgery.
tests here are, like some patients would describe it as a full MOT.
Yeah.
Nothing is left unturned.
No, nothing. They
really
check basically everything. Like they have an X-ray, they have an ultrasound, they check their heart, they do like a full blood test, they look at all of the levels that
and the endoscopy as well, which is not included in a lot of places.
No. And other complications like leaks. The leaks can be caused because they don't use the right equipment. Like there's lots of cheap staplers that we call that what they cut the stomach out. And we use Covidian staplers. So the stapler make is very, very important with leaks. And either they don't use enough staples.
Okay.
I don't know the exact number, to be honest, but let's say it needs to be 10 staples, because for every staple they spend money, the hospitals and the surgeon. And let's say if it's
some
10,
places might staple less for the cost.
Yeah, to cut on the cost. So that can cause a leak. And sometimes it's luck, it can happen. And that's why we actually do 2 leak tests. One is done during surgery. And sometimes with the one during surgery, you can't see the leak. That's why we want the second leak test the day after that they actually go into a BT scan.
Yeah.
And then you will definitely see if there's a leak or not. If it shows there's a no leak on that scan, that means you 100% don't have a leak.
But it's an extra precaution from Prime Health Concept.
Yes, we make sure.
Most surgeons don't do it. They do it during surgery, but we require the second one.
Even our surgeons, with their Turkish patients, they don't do it.
They don't do it.
Because it's extra cost. But we actually make sure that we have that.
Yeah.
Just peace of mind, because
Exactly.
patients are going back home, and just in case. And another thing is, if the patients don't obey the rules, let's say they don't have a leak, their second leak test is clear, but they don't obey the rules, they actually have solid food on liquid stage that can cause a leak. So that's very important to obey the rules.
Yeah.
And the third thing is blood clots, and unfortunately that can happen with any surgery.
Yeah.
And that's why we give blood thinner injections after surgery.
And how long are they on the blood thinning injections?
Usually they are 10 days,
Yeah.
but it could change from patient to patient. Like some patients, because they are bigger than usual,
Could be 20 days.
Could be 20 days. If they have a blood clot history, could be 20 days. It depends on their medical history too, to be honest.
Okay. How many surgeries per day does our surgeon perform? A lot of patients ask this because there's a lot of companies out there who they describe them as a conveyor belt. There's so many people having surgery the same day and it's going throughout the night.
Yeah.
And the patients who are waiting all day get quite nervous.
Obviously.
You know, I'm ready since 11 a.m. and it's now 7 p.m. and I still haven't.
Yeah.
You know, how many?
We actually cut it at 5. We don't perform more surgeries after 5. We just cut it. We just book it for the next day or the next week or the next month. And the reason being is, you know, surgeons are human too. You know, I can't imagine a surgeon doing more than 5 every single day.
Perfectly.
Perfectly, and still be on feet. Like, you would be miserable anyway. And then when your mode is all down, you're not going to be performing it perfectly.
Yeah.
You know, it's not their fault then when you look at it.
And also because every patient has a care assistant in the hospital with them from us, it just makes us look after our patients that bit better.
Yes.
We have more time, you know, we're not running
We give that
like
personal
headless
touch.
chick. Exactly.
Yeah. You
know.
know, when you have too much patients, you lose that.
Yeah.
You lose that personal touch, and we don't want to lose that with
course.
our patients.
Yeah. Another question is, if I come for surgery and something shows in my pre-op test that I can't have surgery, what happens and what am I charged for?
They would actually get paid back, because usually they pay their surgery money before the tests and everything are done. So if they can't have the surgery, they would actually pay back the surgery money, but we would have to deduct like transfer accommodation. If they want to stay the whole time in the hotel, we would deduct that price. Or if we need to change their flights, if they want to fly early and don't want to stay in the hotel.
Some airlines might not charge them, but if it is, it's on them.
Yes.
And then the pre-op test.
And the pre-op test.
So depending on what test you had, etc., the pre-op test cost as well.
We would be calculating all of that, but we don't put any income on top of it,
no
profit on it. So whatever the cost is for all of that, that will be deducted, and they will be paid back the rest of it.
Okay. What if my surgery needed to be pushed a few days? So if something showed up on somebody's test that they needed some medication for 2 to 3 days and then to have surgery, the cost of that, is that put on the patient with the medication?
Charged like accommodation wise, but if it's extra treatment and if the medication costs money, the hospital will charge that.
But the patient is given the option whether to go home or have the treatment here and then have surgery.
And they decide if they want to stay here and just get the treatment, or go back home, get the treatment.
We've had that a few times, because it's actually, they can't see a doctor at home, so it's actually cheaper to stay for the extra 3 days here, have it done.
We had a patient that stayed a week, I think.
Yeah.
Actually.
Before surgery.
Yeah, and she had a surgery and she's very happy now.
Yeah. What if my surgery cannot go ahead? We answered that.
Yeah.
We done that in the first one.
I think we missed a part about the complications.
Yeah. So when people come over, and because they go through so many pre-op tests, at home, they always complain it's very hard to see a GP, it's very hard to see a specialist, or to get an appointment for a certain scan that the GP recommends. They're on waiting lists. When they come here, we've had a lot of patients that have found, certain things wrong with them, that they could still have the surgery, but they needed extra treatment for certain things. They never knew they had it wrong with them.
Yeah.
How does that happen when, they're getting tested at home? Like, what are we doing different here that has shown these complications?
I think it's all the extra tests that we do. They basically have a full body checkup.
Yeah.
And back home, they do tests, but there's so much different blood tests that you can get done. It depends on what levels they're looking at.
Yeah.
And what are they checking.
Where we're checking everything.
We check everything. They look at every single thing. And even if they see a slightly little thing, like we had a patient that with her ECG, something came up, and we actually had to send her out for an extra test with her heart just to make sure she didn't have any issues.
Yeah.
And like just with ECG, they saw that minor things. Some surgeons would say, "Oh, it's just a minor thing.
It's
you
okay.
can't do it. It's okay." But with our surgeons, it's not like that. They want the second test. So I think it's stuff like that. They're just being extra careful here, and that's why the other things are coming up, I think.
We had a patient before that came, and certain levels were up and down. The surgeon wasn't happy about it, and it turns out that she had Cushing's disease.
Yeah.
Do you remember?
Yeah.
And the surgeon said that if the tests were done correctly at home, there's
They
actually
would
a
have
medication for this, and she would have lost the weight. The weight
Yeah.
was because of the Cushing's disease. So we refused to do it because the surgeon did say the lady can lose the weight if she's treated properly.
Yeah.
There's a lot of places that would have done that surgery
Yeah, they would.
that time. And
They
I think
would.
people forget that we've always said from the start, we're very honest, we give you the option as well. We
Yeah.
don't push it on anybody.
No.
And she is still so thankful to this day
Yeah.
for what we done for her,
Yeah.
And I just think that's a really
I
important
think
thing.
it's very important. She would be actually wasting her money.
Yeah, but going
and
through
having
such a
sleeve,
surgery, having a
because
sleeve as well.
She wouldn't have lost the weight because they weren't treating that illness. So, needs to be, patients need to really, really research the company they're going with.
Yeah.
And the surgeon, obviously.
Yeah. So next is plastics.
Yeah.
With plastic surgery, complication can happen in any country. With
Yes.
any surgeon, anything. It's all about for us as well, the pre-op diet is very important for
Yeah.
plastic surgery. We recommend to up your protein
Yeah.
because healing is the most important thing.
Yeah.
So what can go wrong with plastic surgery that...
I mean, with plastic surgery, it's not really life-threatening complications. That blood clot can happen
Yeah.
as usual, but nothing other than that would be life-threatening, to be honest. It's basically the wounds. The wounds can open up. And the reason for that could be diet and smoking. Smoking is a big no-no. It really does affect the wound healing. Patients don't really believe in that. They're like, how can it? But it really does.
And vaping.
And vaping. It's nicotine in it. Even if they say it's nicotine free, there's still nicotine in it.
Yeah.
That will affect the wound healing. And it's actually the surgeon, because the surgeons sometimes perform too much surgery. Or let's say a patient has come out for tummy tuck and they don't have enough excess skin. We actually had one last March that she didn't have enough excess skin, and the surgeon said, right, I can't do tummy tuck, I will only do lipo. Because if he done the tummy tuck, he wouldn't have enough skin to pull down.
It's going to open.
Then it's going to open up. So most of the places, unfortunately, I mean, it happens all over the world, but it happens in Turkey a lot now, especially the last 2 years. We hear so much horror stories about the wounds opening up and everything with plastics. And the reason being is that, because it's either they're not giving the great aftercare, and like with tummy tuck, they need to stay here for 2 weeks. If they fly back home earlier, while they're traveling, they are going to open their stitches. It will happen.
And a lot of patients, when they message and want to come for tummy tuck or mummy makeover, the 2 weeks kind of puts them off a lot.
Yeah.
And they're like, oh, I can't do 2 weeks. And we understand, like, there's kids at home, there's work, there's, you know, life.
Obviously.
But less, like, everywhere else will let you go home within the couple of days, probably a week max from being in the hospital and being in the hotel. But they will have issues because, as you said, the airport is a struggle, and that's why we have we offer the airport assistance until you get on the plane.
Yeah.
But we always recommend to have a companion with you when you're having a tummy tuck because of your arrival back to the UK or Ireland. Lifting up any little bag, you can pull a stitch.
Yep.
You know, it's happens so easily, and sitting on the plane for a long time, if you're not ready, like that 2 weeks just lets us look after you that bit extra.
Yeah.
The wound specialist comes to visit you. You have another visit then with your surgeon before you go home.
Yeah.
Like it's right above us here in the hotel.
And it helps us to see if there is any complicated, because plastic surgery, everyone doesn't get it. Everybody doesn't accept plastic surgery.
Yeah.
Like we had a patient that her body was reacting to the stitches.
Yeah.
And she never knows she had a reaction to stitches because she never had surgery before that. She had to have stitches like how she had in plastic surgery. So you would never know that. But we actually realized that in the second week, because at the first week it didn't give any reaction. It started to give reaction when the stitches were melting. So if we sent that
once they were dissolving, then the reaction kicked in.
Yeah, so if we sent that patient 1 week later home, she was going to have that issue at home, and you can't get help. So we were going to need to fly her all back here, loads of hassle for her and for us, to be honest. It's much more hassle doing all of that. So at the second week, we caught that and we treated it for free. Yeah. And she's so happy now. Hopefully she is going to do a video for us, so we'll put that up too.
And as I mentioned, we have a wound specialist.
Yeah.
So
she would catch stuff like that.
Yeah. So when does she first visit you when you come to the hotel?
It's after you 1 week post-op, she comes and visits.
Yeah, and she just makes sure everything's okay, and obviously she's
and
fully
like
qualified.
every day we go up and change dressings, and I send photos to the specialist and the surgeon. Yeah. So both they are double
and
checked.
if you are worried about anything, they're here, or else we're gone over to the surgeon.
Yeah,
you know.
and they would directly come out and check for that.
Yeah. And we do also have a lot of patients that ask for too much surgery at the same time.
Yes, that's another thing.
They want everything done, you know, and when I respond back saying we can't do A, B, C together because of your healing and it's just not ethical to do this and put you through it. Oh, well, a different company said they'll do it for us and blah, blah, blah.
The one for that is like 360 tummy tuck.
and legs, and like
Yeah.
they want everything done straight away, and you've seen it done. It has been done.
It has been done.
You know, and touch wood for anyone who's going to do it somewhere else, it goes according to plan.
Yeah.
But your healing is bound to be affected.
Definitely.
Regardless, how can you heal with a thigh lift,
A tummy tuck, arm lift,
you know,
all
you have to
together.
bend over with your tummy
Yeah.
tuck. It's very hard. And yourself, like, it takes a lot out of your body as well going through that
Does.
surgery for healing.
And
But
it's another thing with that is it's blood clots.
yeah,
You know, the surgery that if it's a longer surgery, you're higher risk of having blood clots.
Yeah.
So it is very dangerous.
so if somebody was to say, can I have a mummy makeover, arm lift and thigh lift?
We would say definitely no.
Yeah.
We would need to be a second session, definitely. You know, and like the 360 tummy tuck, that's the biggest thing. Like I get loads of messages on my WhatsApp. Another surgeon actually
lower body
recommend
lift.
This. Yeah, but if you have a back lift, lower back lift and a tummy tuck at the same time, which
How do you
side
heal?
are you going to lie on? You know, and our surgeon doesn't do it at all. He directly says no.
Yeah. He never takes a chance on it.
No.
Yeah. So that was mostly a lot of questions we were getting in, you know, they wanted us to chat about on today's
Yeah.
podcast, but
Just wanted to add that, you know, complications can happen anywhere, something can go wrong. You know, it's surgery end of the day, but it's how the company, the surgeon and the hospital handles it.
yeah.
You know, with us, if anything happens, any treatment that is required with that complication will be paid by the hospital, surgeon and us. If your flights need to be changed, we will pay for that extra cost. Accommodation, you won't be paying anything at
else.
all. And we wouldn't send the patient out without knowing she or he is 100% healed.
Ready to fly.
Yeah.
Yeah.
And if it happens back home, we will just fly them back here for free. And I'm really sure that there's no other company nearly doing that.
Yeah.
Because we
But
hear
as,
it.
as well, you know, if anything was to go wrong with anybody, you wouldn't sleep at night.
No, you wouldn't either.
I know.
Yeah, we have
You know,
heart
so it's
palpitations,
like
you
if
know.
I went to get something, I want somebody to look after me or
Yeah.
to make sure I had a comeback. And it's very scary coming abroad.
It is.
Anyway,
Yeah.
you know, if you're at home having surgery, it's scary, but never mind coming
Yeah.
to a different country. And some people can't bring somebody with them to support them, and that's why we offer that extra bit of,
Yeah.
you know, you always have somebody beside you. But to know that, as we said, things can go wrong,
Yeah.
depending on your
Definitely.
body, your reaction, anything like that.
Anything can happen.
You do have the support,
Yeah.
regardless. We're not just
No.
full of shit, as
No.
people can say. You know,
No.
we will be right beside you.
Yeah, definitely. That's
Okay.
why we say we have your back.
We have your back.
Yeah.
Yeah. Okay, until next week. Thank you for listening.
Thank you.